pharmacist for training and the CEO of Generis Limited. The house. Welcome, sir. Welcome, Shegun. I hope this is not what we're going to be going through. Can we just, this should be more than Sheraton standard now. Hmm? All right. Okay. Name recognition continues. Joe Femi. We have a Patricia. A round of applause, please. Round of. Thank you. Thank you. Thank you. Getting right there. Please, once again, I want to recognize Mr. and Mrs. Joe Femi Dagunro. Femi is the president of Nigerian German Chamber of Commerce. Welcome, sir. Welcome. Anthony Onyelera, CEO, Antail Investment Nigeria Limited, is in the house. Welcome. We have also Tayo Omediji, representing the MD CEO of Nexim Bank, is in the house once again. Okay. We'll recognize them as they come. I want to repeat, we have Tajuddin Karim, the CEO, Chief Consultant of Pro Age Limited. Taju, welcome, sir. Okay.
sir.
We have Barrister Ifeanyi Mbano C. Anyi, welcome, welcome. Pius Okan Neme, Pius, welcome. Okay. Once again, welcome to Real News online magazine, 8 events of an 8th anniversary. We're about to kick we're trying to connect our Zoom because the people on the other side of the globe are waiting. So we want to link up everything as we start. Luckily, we have the chairman of the occasion right here. The guest lecturer too is here. And we'll be calling people of the high table. Okay, good. May I have the pleasure of inviting Professor Chris Bode, chairman of this occasion. Round of applause for Prof. Remember, Prof is a CMD, Chief Medical Director of LUT. Prof, you're going to be on the middle. Welcome, sir. So, having seated a amiable chairman, may I call on the guest lecturer, ably represented by the national coordinator, Dr. Sam Aliyu. Well done, Doc. Okay, a round of applause for Doctor, please. Doctor is the National Coordinator, Presidential Task Force on COVID-19. Okay. All right. Then we have please, on the high table, we need badly Dr. Alero Roberts. Doctor? Dr. Alero Roberts is of Community Health and Primary Health Care, College of Medicine, University of Lagos, Idiaraba. Welcome, Doc. Okay. Okay, the high table is swelling up. We'll be playing the national anthem first before the prayers. National anthem. Can we just rise? Music. Thank you. Please be seated. We'll have Dr. David Akala to lead us in prayer, please. Reverend Father David Akala.
God the Father, and God the Son, and God the Holy Spirit, we thank you for the gift of wisdom and for bringing today this occasion of 8 hours of the Realnews that we has been part of. We thank you again for those who have come from near and far. We commend the occasion into your holy hand, and we ask you to take perfect control. Bless the management and the staff, and also our chief guests with your wisdom to continue to be one who continue to speak your wisdom to us and who continue to share with us what is hidden, and for us to be able to realize your deeds among humankind. We ask you once again that all that has come here today, let them be able to go home with something tangible through Christ our Lord.
Maureen, please come over. Thank you, Father. I think you have so, the publisher and our chief hostess, Maureen Chibo, will now be called upon to present her welcome address. Thank you, Maureen. Round of applause for her.
Good morning, ladies and gentlemen. We apologize for starting this lecture behind schedule. We were here by 10, but you know how Lagos is, and some of our guests we're expecting, some of them are still on their way, are trapped in traffic. But we will do everything possible to speed up this program so that we can all leave here on time, and at least we will not be so much behind schedule. This program is being streamed online, so some people are joining us from countries around the world via Zoom, and it's being streamed on Facebook and YouTube. Now let me go to welcome address. Thank you. Your Excellencies, distinguished guests, ladies and gentlemen, and members of my constituency, the media. Permit me to stand on existing protocol to express my delight in welcoming you all to the 8th anniversary lecture of Realnews magazine online. We appreciate your sacrifice and support, especially at this precarious time when the world is reeling under the devastations of the COVID-19 pandemic. We are overjoyed that our guest lecturer, Mr. Boss Mustafa, Secretary to the Government of the Federation, and the Chairman of the Presidential Task Force on COVID-19, is here, ably represented by Dr. Sani Aliu, who is also the National Coordinator of the Presidential Task Force on COVID-19. Sir, you are welcome. We are grateful that the SGF made time out of his busy schedule to honor our invitation. As a matter of fact, as at Wednesday night, I was given all the assurance that they told me 99.9% that he will be here, but that I should pray hard for that 1% remaining, that something will not come up. But you know, he's a very busy man, and something did come up, but we are assured that the national coordinator here will do justice to it, because he is also part of the team that he is the chairman of. So we are not going to miss a thing. Everything he will be taken care of by Dr. Sani Aliu. So you are welcome once again. We owe a debt of gratitude to Mr. Olusegun Adekunle, former Permanent Secretary, General Services Office, OSGF, and Alhaji Tajuddin Karim, Media Consultant, Pro Edge Communications Limited, Mr. Willie Bassi, Director Press, OSGF, and Maurice Imbieri, Permanent Secretary, GSO, OSGF, for facilitating our guest lecturers' attendance at this lecture. We are also elated that Professor Chris Bode, the chairman of today's occasion, who is also the Chief Medical Director of Lagos LUT, Lagos Teaching Hospital, that Lagos University Teaching Hospital, that he is here today. Prof, you are welcome. Thank you. He was here very early. And we are going to be very snappy so he can also meet another appointment that he has elsewhere. We are most grateful that our chairman, and thank you, my big brother, Alhaji Tajuddin Karim, for supporting our efforts to ensure that Professor Bode made it here today. Our special welcome goes to Malam Melek Kayari, Group Managing Director, Nigerian National Petroleum Corporation, NNPC, Dr. Alero Roberts, Dr. Michael Ihemaguba, for accepting to serve as our panel discussant. The NNPC delegation is trapped in a hold-up. And as I'm here, they are calling me, but I can't pick this call, but I'm sure they are on their way. The last I talked to them, they said they were somewhere around Eric Moore, but they will be here pretty soon. Thank you, Dr. Donna Umesi and Dr. Derinu, for ensuring that Dr. Roberts made it here. It was through them that I was linked up to Dr. Roberts. Dr. Roberts, you are welcome. Thank you. Dr. Ihema Aguma, who is based in New York, will be joining us via Zoom. He returned to his New York base just in October. He was home here, his niece died, so he came back home here. So he couldn't stay that long enough to be here again. We are most grateful. Our welcome also goes to members of the PTF and federal government officials who accompanied the guest speaker to this occasion. We welcome the Consul General of Ghana High Commission in Lagos. He is here. Sir, you are welcome. Welcome, sir. Please accept our sincere condolences over the sad passing of former President J.J. Rawlings, a great Pan-Africanist and respected statesman. We pray God to grant his soul a peaceful rest. Condolences, sir. The anniversary lecture series is one of the Realnews, ways Realnews contributes to nation building and development by providing a forum for policy change-oriented discussions by professionals, scholars, technocrats, decision makers on the way forward for our great nation and Africa in general. In 2014, we focused on elections. In 2015, the theme was on the economy. In 2016, the discussion was on security. In 2017, the 2017 lecture, the theme was on challenges of leadership in Africa, while the 2018 lecture dwelt on Africa's political transition and economy. Last year, the focus was on economic narrative for West Africa beyond politics, with the subtheme, the end of oil, without the Nigeria economy. Realnews Real News is free, but without your support from the public or private sector alike and civil society, it will not survive. The support can be in form of advertisement, special supplement, and special features on your company organization for publication on our website. We also welcome capacity building programs for our staff to serve our clients. Real News is also intermedia consultancy, writing of books, biographies, image surveys for companies. Over the years, the books we have published include Federal Road Safety Commission in the Eyes of the Media, Volume 1 to 3, Pathways to Political and Economic Development, and Paragon of Journalism, Volume 1 and 2. We are working on several manuscripts and require sponsors for the publication. These are some of the ways we raise money for our free on-source publication with investigative journalism as our first love. In addition, we also welcome whistleblowers in the world of Real News magazine. Rest assured that all information provided will be handled with highest sense of responsibility and confidentiality. You will be wondering why Real News convened this lecture on managing COVID-19 global pandemic, the Nigeria experience. You will recall that early in the year, there were grim predictions that Africa will record millions of dead people in the streets. But here we are, several months down the line. The prediction has not come true. What happened? Is it a fluke? Is it just because Africans believe so much in God and some of them and some of our pastors said back to sender when the grim statistics were made? Or is it because of the steadfastness and discipline and policy orientation, policy directives that the government took at various levels, both at the state, at the federal, state, and local government? I am not the expert, but we have assembled all the people who, one way or the other, played a role to find out what exactly transpired. Because what happened in Africa is now going to be a case study. Millions are not dying, and we are happy. But also, we are sad that some people also died. So it is one death too many. But our sadness, we are relieved because the millions predicted to die, it didn't come to pass. But how it happened is what our lecturer here and Dr. Lero Roberts, who is the panelist, Dr. Ihema Agoba, who is at the epicenter of coronavirus pandemic in faraway New York, will be telling us how it was managed here in Nigeria and also share experience of what happened in the US. And I think with this, I will now conclude. Before I conclude, permit me to appreciate members of the Real News Hall of Fame who are here. Real News Hall of Fame is our modest way of honoring lecturers and speakers at our anniversary lectures for their contributions to knowledge and national development. We also honor Real News ambassadors. We don't pay them when they come to give lectures. You know that before you can attract somebody of the caliber of Dr. Liu to give a lecture into the Real News Hall of Fame. And we have a whole lot of people who have given us, who are members of Real News Hall of Fame, including the former president of Ghana, John Mahama Dramani, who delivered a lecture last year. May I also crave your indulgence to thank members of the Real News team for their commitment, hard work, and sacrifice. Mr. Paul Ejime for his editorial guidance, Mr. Adama Gaye, Chief Executive of CEO of New Force Africa, based in Senegal, now in Egypt, Mrs. Comfort Coleman, CEO of Nekego Resources, and Sir Elvis Eze Emecheta, CEO Elvis Group, for the encouragement and advice. I cannot end this address without thanking all the corporate organizations that made this year's Real News Anniversary Lecture possible with their support and advertisement. They are the Nigerian National Petroleum Corporation, NNPC, Fidelity Bank, Nigerian Liquefied Natural Gas, First Bank of Nigeria, Nigeria Communications Commission, Central Bank of Nigeria, Bolton White Hotel, Abuja, Nigeria Export-Import Exim Bank, and Generis Global, which has introduced a wonderful product which is displayed outside at the hotel entrance lobby. We are most grateful to you all. Thank you for your attention. Welcome once, one and all.
Big round of applause for the publisher and our chief hostess. Now we have the chairman in the house, and we're going to call him to give us some pep talk. Let me do a quick introduction of our amiable prof. Prof. Chris Bode, chairman of the lecture, doubles as the CMD of LUT. Renowned pediatric surgeon with a special interest in neonatal esophageal surgery and pediatric penile reconstruction. Professor Bode hails from Ejibo in Osun State. Are we following? Yes. I'm briefly introducing our chairman. He obtained an MBC, CBH, CHB at the University of Ife, now Bafemi Awolowo University, in 1980, and trained as a surgeon in LUT from 82 to 90. He became a fellow of the West African College of Surgeons, as well as a fellow of the National Postgraduate Medical College of Nigeria in 1992. He won many travel grants and awards, including the Sir Manuel Manoa Memorial Award for overall best candidate at the finals of the NPMCN examinations in 1992. He also trained a pediatric laparoscopy at the Schneider Children's Hospital, Tel Aviv in Israel, and has had surgical training opportunities at the Manchester Children's Hospital, UK. He joined the College of Medicine of the University of Lagos in November 1992 as a lecturer and was honorary consultant pediatric surgeon to LUT, with special interest in neonatal esophageal surgery and pediatric penile reconstruction. He rose to become professor of surgery in 2010 and served LUT as SAFCOM Nodal officer from 2008 to 12 and as chairman medical advisory committee 2012 to 14. Professor Bode was Secretary General of the West African College of Surgeons from 2001 to 7 and treasurer Pan-African Association of Surgeons, among others. For accepting to serve as the chairman of the Real News 8 online magazine lecture, you are inducted into the Real News Hall of Fame, Prof. Round of applause.
Thank you very much. Distinguished ladies and gentlemen, it's very easy for me to, and I'm going to crave your indulgence to allow me adopt the well laid out protocol earlier said by Madam Maureen. It's indeed an honor for me and a great pleasure too to be invited as chairman on today's occasion. I recall 2 months ago when Alhaji Karim asked me to do this, I was reluctant and I asked for the footprint of the group inviting me. But when Madam Maureen sent me the pedigree of her magazine, I was intimidated, especially looking at the list of prominent international figures who have spoken at the past series of this eponymous lecture. which is a testimony to what Real News magazine is doing in pursuit of its mandate. The mandate is to build a fair and just society where fundamental human rights are respected and citizens have the freedom to pursue their interests in the world without hindrance. A year ago, when, as we heard before, when the COVID-19 disease was ravaging Wuhan, China, and very soon when it started spreading to Europe and America, predictions were apocalyptic for the developed world, especially for Africa. As we watched experts and healthcare workers mown down and dying, while a lot of people perished. We saw pictures, graphic pictures of patients dying in car parks, and we wondered what will happen to us in Africa. Our people rose as one, and in a concerted effort, the like of which we have not seen in a long, long time, we turned that grim outlook into one of unbelievable optimism, now the object of several studies from other climes. We must harness this resilience and adapt it in confronting all the challenges that face our sub-region. Let me at this juncture thank the head of state and also commend the efforts of the Presidential Task Force, ably headed by the SGF, who is so well represented here today by Dr. Sonny Aliu, the National Coordinator of the Presidential Task Force. Sir, you're welcome. And I must publicly commend your group for the unflinching support you gave to everybody who rose in challenge against the COVID-19. At the Lagos University Teaching Hospital, we treated over 600 patients, and we tested almost 9,000 patients, all free of charge, but with the able support of the PTF, the NCDC, corporate organizations, Lagos State government, and a lot of private individuals who rose as one to support our efforts. Thank you very much, sir. This is an expert to give this talk, and I am also anxiously awaiting to listen and learn from what you will say. The three-man panel discussion that will follow is also something we are eagerly awaiting. Malam Mele Kiari should join us very shortly, the Group Managing Director of the NNPC. He played a key role in mobilizing resources on behalf of corporate organizations and the COVID group. Dr. Alero Roberts and I work together.
Need to move to this end. Dash. So while we're setting up, I'd like to first of all start by pleading to stand on existing protocol. On behalf of the Secretary to the Government of the Federation and Chairman of the Presidential Task Force, who unfortunately is unable to be here today but conveys his apologies, I would like to thank the organizers of this lecture series. I would also like to personally thank the members of the media for the support we've had since we started this special assignment on behalf of Mr. President. I think there's no doubt that Nigeria has had a relatively mild COVID pandemic compared to what is going on in other parts of the world. And the question keeps on being asked, why was Africa different to the rest of the world? But I can remember back in March, April, and early May, the same question was being asked about India. And India is now in a different boat. So my warning to all of us is, as the chairman said earlier on, this is far from over. We need to be careful. We need to protect ourselves and our loved ones. We need to realize that until it is over, we just have to continue putting those measures in place to protect ourselves. The virus is very much around. It doesn't matter if we are announcing 200 or 300 cases a day in Nigeria. If you happen to be part of that statistics, you really could potentially be in trouble. We've looked at our data over the last 9 months, and the mortality in Nigeria, if you stratify it based on age, is actually pretty worrying. Above the age of 50, 23% of our cohort died. If you're above the age of 60, about 27% died. That's far more than any other statistics we have across the world when it comes to mortality. So it doesn't matter that we don't have a lot of cases. If you happen to fall within any of those cases and you happen to have a vulnerability, whether this is diabetes or some other underlying medical condition, or it's your age, then luck could be against you. And as I keep on saying, whenever I have the opportunity, I always give the example of crossing the road. If you are told to cross a particular road, let's say across Sheraton here, and you are told that your chances of death is 23% because you are above the age of 50, will you cross the road? I probably wouldn't even come to Lagos in the first instance. So we've got to be careful. That's the message, really. While the PowerPoint is loading, I also wanted to briefly talk about the Presidential Task Force and why it was set up in the first instance. As the chairman said earlier on, back in December, this problem started in Wuhan. We all knew that eventually it will spread to the rest of the world because viruses do not respect borders. And it did. By February, we were having a lot of cases in Europe. And of course, the link between Europe and Africa is very strong. The same with North America and Africa. So inevitably, it will eventually come to Africa. And it did. In fact, my probably arrived to Nigeria much earlier than the first case in the Italian that we had, because there were anecdotal reports afterwards of strange respiratory illnesses in some parts of the which at the time we were COVID. By March, things were starting to look a bit worrying. In his wisdom, conveyed a few of us, and there were discussions, informal discussions about what could be done about COVID. And at the time I was in the UK, I came in first week of March, and I had discussions with the leadership, and we decided that the best thing at the time was to have a task force that would have presidential approval and would also be able to take decisions quickly. It also needed to be in a deliver in a multi-sectoral manner and coordinate across the various ministries and agencies. And this was how the PTF came on board. The PTF is unique in that the majority of the membership is drawn from ministers, members of cabinet, which I believe has not happened before in any large body. We have 9 ministers. We have the SGF as the chair. We also have 2 chief executives, the head of DSS and the head of NCDC, plus the WHO country representative. And I must give credit to both the chairman of the PTF and the members of the PTF, because when we started, we were meeting virtually every day. We were finishing very late. We were having to take decisions that were difficult decisions that affected people's lives and livelihoods, and that no doubt had to be taken in order to protect ourselves and protect our citizens from this infection. Mr. President gave us all the support we needed. I can say very clearly that the decisions we made were free of political influence. Were completely free of political influence. They were technical. So the first slide talks about the timeline of key COVID-19 global events. I don't know whether you can imagine the slides while I talk. Probably not. But I'll just carry on. So the first slide talked about the timeline of key COVID-19 events. Looking at exactly a year ago when things started going wrong in Wuhan, there was a report of respiratory tract infections. So moving on, in the first case occurred on the outside China on the 13th of January. By the 30th of January, the WHO had declared COVID-19 a public health emergency. In mid-February, experts from including Nigeria were sent to China by the WHO on a study mission to find out what was really going on. By the 11th of March, the WHO declared COVID-19 a global pandemic. I came into the country around the 16th of March because the PTF was inaugurated on the 17th of March. On the 16th of June, the first set of clinical trials that would with certainty say that a particular drug was effective, and this was dexamethasone, was announced on the 16th of June. By the 23rd of June, the Oxford group declared the first phase 3 clinical trials of the COVID-19 vaccine. And we're now faced with the second wave of COVID infections in Europe and also the United States. Oh, thank you. Can we... So who's operating the slides? Can we have the lights off at the front bit? Sorry, I can be very demanding, but... Okay. I think I'll just leave the podium. Let me have the first slide first. Let's move to the first slide. Camera, you don't need to... you're blocking a lot of... Can we move on to the next slide, please? Next slide. Yes, so this was the timeline I spoke about for global events. And you can see right at the bottom are the number of cases in the world. December 31st, China had 27 cases. And progressively, the numbers have been going up. And we now have about 55 million people infected. And when people say to me that they do not believe COVID-19 exists, I tell them they don't believe that 55 million people exist. They do not believe that those who lost loved ones did lose loved ones as a result of this. Next slide. So the next slide talks about the cumulative epi curve. This is the number of cases we're seeing. And you can see that most of the cases at the moment are in Europe. You can also see the initial rise and then a decline. And since then, the number of cases has taken off properly. And in fact, people underestimate the extent of the second wave. With the second wave, some countries have had more deaths from the second wave than from the very first wave of COVID-19 infections. Let's move to the next slide, please. So, as I said, 55 million confirmed cases so far. 1.3 million deaths. That's a lot. 219 countries and territories have been affected. Again, I've had discussions where people with hindsight have said we should have closed our international borders earlier, particularly our airports. And my pushback is no country on earth has been spared other than the small islands from COVID-19. So even if we had closed the airports early, we still would have had importation of cases. In fact, after we closed the airport, within a week, the largest number of cases that came into the country came through the land borders, Ogun State. So it didn't really matter that we closed late or we closed early. Eventually, COVID would have arrived to Nigeria, regardless of what we would have done. Next slide. So this is, again, a timeline of the key events, this time around from the national perspective. So February 27, we reported the first case in Ogun State from an Italian. And then President Buhari inaugurated our presidential task force on the 17th of March. By the 23rd of March, we had closed international airports. 30th March, we locked down some states. Lagos. We started off with Lagos, Ogun, and FCT, and subsequently, a few weeks later, we locked down Kano. But some state governments actually took the pragmatic step of locking down their own states. And I think with hindsight, I would have preferred a situation where we would have locked down the whole country, because really that would have been more effective. But at the time, there was a lot of concern about the impact of locking down on the economy and also the impact on people, because as we know, the majority of our citizens work in the informal sector. They have to go out on a daily basis to seek food, etc. In fact, when we relaxed after 5 weeks, we didn't relax at that stage because we thought that we had it under control. No, we relaxed because the reports that we were having in terms of the likelihood of public unrest was very high. We knew that we had pushed it for as far as we could go at that particular moment in time. And there was a risk that we could lose public support and confidence if we had continued. Next, okay. And then we had, subsequently we started relaxing. International flights resumed on the 20th of September. The schools reopened on the 12th of October, and NYC orientation were opened in last week, I believe. And you can see the numbers in Nigeria. We started off 1,322, then up to 57,000, and we are now running at around 65,000 cases. But what we know is, for every one case that we confirm, we are most likely missing between 7 to 10 cases. So really, our true number of cases in the country is far more than the 65,000 that we're talking about. We're probably around 600,000 to 700,000 cases in total. And of course, this is a summary of the national picture. In terms of tests, we've tested about 700, just over 700 tests in the country. Very low per capita of our population. Ideally, we should have tested a lot more. We gave the states have responsibility for testing of between %. Microphone running out of battery. So we gave the states a target of and interestingly, only FCT approaching about 1.5% of their population in terms of their testing. Lagos has also exceeded 1%. Plateau, Gombe, and one other state are also approaching 1%. But about 28 states have tested less than a quarter of 1% of their population for COVID-19. And if not test, how would you know you have a problem? there are some states that have tested less than 100 cases since we started. So unless you want to play ostrich and put your head in the sand, you cannot be certain that you know the state of your epidemic in those parts of the country. We can say hand on heart, we know what's happening in Lagos, we know what's happening in FCT, and maybe 2 or 3 other states. But that's it, really. For the rest of the country, we are not really sure what's going on. And the issue of testing isn't just about political support for testing, it's also about social acceptance. Because of the stigma and discrimination related to COVID-19 positivity. Thank you. Yes. So because of the issue of stigma and discrimination, the public are also not coming out to test. We've worked with the state governments to make sure that sample collection centers are available in all states. We've opened molecular labs across every single state, working both with the public and the private sector. But nevertheless, people are not coming forward to test. The symptoms are very clear, but people would rather stay at home and see whether they recover rather than coming out to test. So the warning is, yes. If I remove my mask, I will contaminate the speaker. Not that I have COVID, by the way. I don't have COVID, but it's not good practice to remove mask if you're speaking into a microphone. The next person could end up. But if you can hear me can you hear me? I can shout. Okay, so I can keep my mask on then. Thank you. Okay, so. As I was saying, really the number of tests is insufficient, and it's not just about the political will to set up testing across the country. It's also about the acceptance of the test among communities. And it's one of the things that when I think about what we've done back in March, April, if I was going to change one thing, that thing would have been to change our strategy in terms of risk communication and community engagement. When we started off with the PTF, a lot of our interventions were very clinical interventions. Okay, we need to test a lot more, we need to diagnose, we need to isolate, we need to treat. But the non-clinical side came up much later when we started realizing that communities were not really accepting what we were saying. You ask people to wear a mask, they just ignore you. Physical distancing, no. Staying at home, again, only the elites in a large number of cases were actually listening to us. The bulk of the population were not aware of their risk perception. And it was quite clear the only way we could change this was to work with community leaders, traditional rulers, religious leaders, because if I come out and advise you to do a particular activity, you may not accept what I say. On the other hand, if you have a community leader who is with you all the time and comes out and says this is what you should do, it's more likely that you will accept. So that's something that we would have done differently right from the beginning, but we are playing catch-up. We've met with the Northern Traditional Leaders Council. We've also met with religious leaders across the country, and we are working towards a meeting with the Southern Traditional Leaders Forum as well to push across this message, because it's all about ownership as well as responsibility. Let me have the next slide, please. So what was the economic impact of COVID-19? It's been huge on the Nigerian household, really huge. We interviewed towards the end of the lockdown, when we started relaxing the lockdown, we worked through with the NBS, National Bureau of Statistics, and we interviewed close to 2,000 households, and we asked them the impact this lockdown had on their livelihoods. And interestingly, almost half, 42%, lost their jobs during the lockdown. About more than three quarters, in fact, almost 80%, reported a decrease in their household income. 85% were subjected to increase in the price of food items, which is not surprising, with almost 51% of households reducing their food consumption as a result of the cost of food. So, which is significant because if you consider children under the age of 5, if you cut their consumption by half, what happens? You end up with malnutrition. 38% of households with school children reported inability to engage the children in any form of learning. We talk about virtual learning, etc., but have access to virtual learning. 26% of households could not afford access to medical services. In fact, when we had the problem with Kano back in April or so, when there was an excess number of deaths, a lot of people were dying, a lot of them elderly persons. We looked into it, and even though the formal report is not out yet, yes, there was COVID in Kano. Yes, COVID definitely contributed to the deaths. But what we also noticed was the fact that people did not have access to medical care easily during that period. Most of the private hospitals in Kano were closed. The few general hospitals and teaching hospitals that were open, people were afraid to go there because of COVID. So you had persons in their 60s, 70s who may have a medical illness that usually would have been treated in a straightforward manner. They would have gone into hospital a few days, get their drugs, and get better, unable to go to a hospital, or being turned from one hospital to another, being told that they need a COVID-19 test. In fact, during that period, even if you didn't have COVID, if you have a conventional bacterial pneumonia, you probably would have died because they would insist that you have to have a COVID test before they treat you. And it's only later on that we got the system sorted, and we then had holding areas in virtually all the medical centers and the teaching hospitals that allowed patients with respiratory problems to come in and be triaged and be treated initially before the COVID PCR result emerged. But I'm sure a lot of people died because of that issue of access to medical care. So what were the coping mechanisms? The majority of people reduced their food consumption in order to cope with the economic impact of the lockdown. Some went on to their savings. Some borrowed from friends and family or requested assistance, and others engaged in additional income-generating activity. But what income-generating activity can you do if you are staying at home? Not much, really. As farmers, we did allow the farmers to be excluded from the lockdown because of the impact this would have on food availability in the country. So this is an interesting slide. It's not coming up very clearly, but I'll just quickly describe it. The blue line is 2019. The orange, the first slide, looks at outpatient attendance. And just by looking at that, you can see that there were a lot fewer people attending outpatients in 2020 compared section, which is in the middle. It looks at the incidence of HIV counseling and testing, the number of persons being counseled and tested for HIV. In 2019, especially towards the end of 2019, a huge number of persons were tested for HIV because the US government, through their PEPFAR program, put forward what we call a surge after our HIV AIDS survey, which was completed a year earlier. But all that program came to naught when COVID appeared, because suddenly, of course, people were not coming out to test for HIV. And the same issue as well with malaria. With malaria testing, fewer people presented for malaria testing in 2020 compared to 2019. So on balance, what are these slides showing? They're showing that access to medical care was limited during the period of the COVID-19, and therefore the impact of other disease conditions on mortality was more obvious in 2020 than in 2019. And I strongly believe that there were a lot of excess deaths in 2020, not because of COVID-19, but as a result of COVID-19 in our population. Whether this is under 5 mortality, whether it's maternal mortality, whether it's mortality due to other non-communicable diseases such as diabetes, etc. But the impact on our health system has been really huge, regardless of the fact that we haven't had a terrible epidemic. But the indirect impact has been really significant. So there's always a silver lining in every cloud. There were some positive impacts, if you can call it positive, if you have an epidemic. From the point of view of the health infrastructure, when we started in March, we had about 3 or 4 molecular labs in the country. They were all national reference laboratories that were mostly administering tests for things like Lassa fever, yellow fever, etc., and Ebola. By later on this year, in the last few weeks, we've now got over 69 molecular laboratories have been activated. In fact, about 20 molecular labs are now in the private sector. We've got 37 new treatment centers and ICUs that are being built across the country based on a budget that was put forward by the Presidential Task Force. And I believe a lot of the teaching hospitals and federal medical centers would have received the first tranche of funds for this. And we know that infrastructure is critical to an improved health system. If there is one thing that the country needs to benefit from, if we can ever benefit from an unfortunate set of events, it's really the need for us to reset our health system and to improve funding for health. Because we can see the impact of disease conditions on our economy. As they say, a healthy nation is a wealthy one. If the majority of your citizens are not healthy, it doesn't matter how many roads you have, it doesn't matter how many railways you've constructed, etc. Nobody will be able to use them. Health and education, I strongly believe, provide the basis for any sort of development in a country. And I really hope that moving forward, we've already seen this from the 2021 budget. There has been a significant increase in what is going to health, and we hope that this will continue, especially when it comes to the issue of the Abuja Declaration, the 15% derivation for health. This really needs to be pushed through. We deserve a good health system, and the country really shouldn't really be caught again in this sort of situation where you have a major pandemic and you're having to start from a very weak foundation and having to build, because it's not easy to build a system in an emergency situation. It's really challenging. One of the advantages we've had is the relationship, the really close relationship we've had both with the private sector as well as with the donor community. The Coalition Against Coronavirus Disease was set up by the CBN governor together with his business community colleagues, particularly Alhaji Aliko Dangote, and the chief executives of the major banks, Access Bank, GT, and subsequently NMPC created their own separate downstream sector. And the two have been really instrumental to how effective the PTF has functioned. We've been able to reach out to them in times of need. We never get money from them because we don't want money. What we're interested in is what needs to be done, the impact. Without COVID, I can say with certainty that we wouldn't have been able to open the international airports at the time we did. Every single state. And despite the unfortunate set of events that followed the palliatives, I can say that the amount of investment that went into those palliatives was significant. COVID will at some point provide more detailed analysis of what they have done, but there's no doubt this degree of partnership between government and the private sector needs to be national airports, and within a day, we get the private sector to set it up. If it's government, it will take much longer because we have a more bureaucratic procurement process, etc. But the private sector was very effective. And the same thing with the donor community and the multilaterals, such as the UN system and the US government, etc. A lot of the laboratory test kits that we use, possibly more than half of the 700 we used, I'm very sure, came from the donor community and the private sector. We are in the process of procuring a large quantity of test kits, including PCRs and rapid diagnostic test kits from the government side. But the private sector and the multilaterals, as well as our other donor friends, have really delivered. Where it's a case of how would you know your friend when in a time of need? And those friends have really come forward for Nigeria at our time of need. Local production. I wish we could have done more with local production, but certainly COVID-19 has stimulated local production of PPE, face masks, etc. One of the issues that we think should be carried forward post-PTF is the need for infection prevention control to become a major part of our health delivery. There's no reason why it's only during an epidemic that hospitals would put aside money for PPE. PPE needs to be part and parcel of every procurement process for a hospital in Nigeria. In the same way that you'll buy needles and syringes, you need to buy face masks, you need to buy PPE and keep them for the rainy day. As we set up new isolation centers in every state, in every teaching hospital, a single teaching, we are setting up ICU, what we call infectious disease units, small units that can be used for isolation, that would have attached to them a small ICU unit and also a small molecular laboratory, one per state, from a chosen federal medical center or hospital, general hospital. When we do that, we expect the hospitals that would benefit from this to make sure that they invest in the equipment and in the commodities that are required for those places, so such as PPE, etc. We have trained thousands of healthcare workers in infection control. We are also asking these institutions to make sure that they have access to decent running water and hand washing facilities for those wards. And where there are situations where we do not need to put an isolation unit or an ID unit in a hospital and there are excess funds available, those funds will be pushed towards provision of water and hand washing facilities in the hospitals. Because we really need to improve the standard of hygiene in our hospitals. Hospital infection control has to become a major pillar of whatever we do moving forward in the health system, because we can see the advantage of making sure that you have an effective infection control policy in your hospital. A lot of healthcare workers were infected with COVID-19. At any point, about 5% of our infections were coming from healthcare workers, and that cannot be right. We've got to make sure that our health workers, our staff, are protected and they are trained on how to protect themselves, because it's not just about having the PPE, it's also about whether or not you can use it properly. And here we will continue to support the local industries in providing this. Can we move on to the next slide? So the next set of slides basically talking about the initial preparedness and response we had prior to the first case of COVID-19. It may interest you to know that even before the PTF was set up, the Federal Ministry of Health, working with the NCDC, had what they call a multisectoral national coronavirus preparedness group. And some of you might remember that the first set of press interviews were being done by the Honorable Minister of Health together with the DG NCDC before the PTF came in. And at that time, we really were starting at a very low base. Only 3 molecular labs, very, very few isolation centers available. Let me have the next slide, yes. And from January 22nd, a number of interventions came in place, and they started reaching out to the different parts of government, as well as establishing interim protocols. Next slide. So this is really to show you how the PTF works. So at the top, you have Mr. President. Then we have the Presidential Task Force chaired by the SGF, and then myself heading the technical arm of the PTF. And then we have what we call pillars. And these pillars are synonymous with any other infection, any other outbreak that you might have. It's run almost like an emergency operating center with an incident and command structure. So we have pillars. Those pillars are led by specific institutions. So, for instance, NCDC has 3 pillars: surveillance, laboratory, and infection prevention control. The Ministry of Health has 2 pillars dealing with case management and research. The Federal Ministry of Information led the risk communication arm. The point of entry was actually the Federal Ministry of Health together with aviation. It's not the Ministry of Defense. And then Interior had responsibility for security, logistics, and mass care. And all these ministries were represented at the PTF by their ministers. We then also had a link with the Governors Forum, and through that with the state emergency operating centers. So this slide is really just showing the measures we applied. What did we do at the beginning? The first month, it was all about setting up emergency operating centers, rapid response teams, our own secretariat of the PTF, as well as trying to stem the initial cases that came up. By March 18 to the first few weeks in April, we made a number of interventions that restricted movement of people, including international travel, state lockdowns, and increasing testing centers, as well as generally making life inconvenient for everybody. But then there was a good reason for it. We wanted to interrupt the transmission of COVID-19 in the country. And I feel that even though there are many reasons why Africa, and Nigeria in particular, had a mild pandemic, but one of the things that was very common among the African countries compared to Europe, etc., was the early interventions that were put in. We didn't shy away from locking down. Whereas I remember the UK, there was a lot of, shall we do it, shall we not do it, etc., and then finally they had to lock down because it was inevitable. And the lockdown that happened in Africa was a lot more severe than the lockdown that happens elsewhere in other parts of the world, except maybe China. Even now in the UK, with the 1-month national lockdown, you can still go to work if you cannot work virtual. The schools are open. You can go and buy food because the shops are open that sell essential things, etc. So it wasn't a complete lockdown. From April 11 to date, most of our focus has been on interrupting community transmission. We've continued to work very closely with the states. One of the things we realized early on is that you cannot control pandemics from a federal level alone. You have to involve the state governments. And secondly, whether it is at state level or federal level or national, it's really the body language of the leadership that tends to define whether or not an epidemic control is going to be successful. And here I'll draw your attention to some countries in the world, such as Brazil and the United States, for instance, where clearly the leadership gave very mixed messages about how COVID should be controlled. And what happened? A lot of the people within the populace felt, well, if the leader is not even sure, then why should I take any precautions? And wearing face masks became a political statement in some of those countries. Whereas in a lot of the African countries, and even in Nigeria, the leadership has been very clear. We have been very consistent with our messaging, whether it's coming from Mr. President or it's coming from the Presidential Task Force side. COVID is real. It's a viral infection. It can infect anybody. If you are careless, almost certainly you have a high risk of catching it. But if you do 1, 2, 3, 4, 5, it's very unlikely you will catch it and you will remain safe. And that message has been consistent. And even with the issue of vaccines coming through, I keep on saying it's great to have a vaccine. It's excellent to have a vaccine with 95% efficacy. But delivering a vaccine in a setup like the developing world is not going to be easy. And almost certainly not everybody will get the vaccine. It will go to healthcare workers and it will go to those that are vulnerable parts of the population. But the youngest person to die of COVID in Abuja was just 39 years old. So that person wouldn't have had a vaccine. Therefore, those non-pharmaceutical interventions that we still feel are inconvenient, wearing of face masks, avoiding social gatherings, etc., will continue to be relevant for at least the next 1 year, regardless of whether a vaccine comes through or not. So April 11 to date, we continue to do most of these activities, working with the state governments, also working towards making sure we do not have importation of cases. From the international airport side, we had to open the international airports because of the impact this was having on our economy. When we opened it, there was a lot of noise about how the testing was being done. And I just want to mention 2 or 3 things. Yes, we do double testing for a reason. If you are leaving your point of departure, let's say London, and you are coming to Nigeria, if there are 100 of you and you all have negative COVID PCR results in your hand, you take to Heathrow, you board your flight, you come to Nigeria. If we tested you again, if you did the test within 72 hours, and we tested you again, and let's say all 100 of you caught COVID on your way to Heathrow, maybe there's a taxi driver who is coughing and spluttering, and 100 of you catch COVID. If you arrive in Nigeria and we test you again, we will only pick 7 of you as positive because of the incubation period. The incubation period for COVID is between 2 to 14 days. If we delay that testing and ask you to stay at home, and we go back and test you at day 5, we will pick 85 of you. If we delay the testing and ask you to stay at home until day 7, we will pick 96 of you. If we delay the testing until day 14 and we lock you up at home until day 14, we will only miss 1 case. So that's the reason why we do not test at the airport. If you have had a test pre-boarding within 72 hours, it is a waste of resources, it is unfair on the passenger, and it's not going to impact our intervention. So that's why we said, let's take day 7. We can afford to miss out on 4 cases if we can get 96%, which is good enough. Secondly, people ask me, well, why do people have to pay? Why can't we do it for free? We cannot do it for free because Nigeria is a large country. The number of passengers we get coming into the country is not small. On average, if we were to open all the airports, we get up to 7,000 passengers a day. A day. Up to 7,000 passengers a day. If you translate that to a month, how many test kits will you use? More than 3, almost about 300 test kits or so. So if that is the case, over 9 months, we've used 700,000 test kits. It means within 2 months, we will exhaust our test kits. We put in our budget for 1 million test kits in the country, 18 billion naira. 1 million test kits for travelers. It will not last us 4 months. Tell me which country can afford to be spending 18 billion naira every month, every 4 months for travelers when travel is supposed to be a personal pursuit? No, we cannot afford a PCR test. However, we are working towards looking at the rapid test kits at day 7. They are less sensitive than PCR, no doubt. At the moment, our positivity rate for passengers, when we tested the first 5,000 coming in, we picked about 105 cases that were positive at day 7. So if we average that, it means that if we were not testing, we'll be missing between 110 to 150 cases every day coming into the country. And that's why we just have to test. But we will look at antigen testing. We're already working on it to see whether that will allow us to bring down the cost of testing. But there's no doubt we'll have to test if the airports are going to be opened, remain open. And it's an inconvenience that passengers will have to take as a sacrifice for leaving our airports open. Let's move on to the next slide. Just quickly, I'm aware of time. In terms of achievements, I think the coordination side has probably been the strongest point for the PTF. We're able to reach out to ministries, especially ministries on the PTF side. We're able to take fast decisions. For instance, say to aviation, no, we don't want flights coming from this country, and it happens. saying to Foreign Affairs, we need you to work with the diaspora people and explain to them why certain decisions are being taken. Working with the humanitarian side, for instance, and making sure that some of those palliatives, when we started having problem with the NSAS and the palliatives were being, people were stealing palliatives, because really it was stealing in a way. It hasn't been distributed to the public yet. It's not your property. You cannot go and you cannot take something that is not yours. Even if it's going to eventually be given to you, you're not supposed to take 4 bags of rice and take it home. We would have given you 1 bag of rice each. So when that issue came up, having the PTF was useful because we were suddenly able to mobilize ministries as well as the private sector, identify warehouses where there was going to be potential problem and make sure they were secured. At one point, we had people trying to break into our main warehouse in Abuja, and there were no palliatives there. They were just PCR kits, laboratory tests, equipment, etc. And if that had happened, the entire COVID response would have collapsed in the country, because this was the point at which we usually distribute items to the states. But there was a lot of coordination. We were also very effective in following up persons of interest, activating the laboratories, improving treatment and infection prevention control. We worked a lot on the risk communication side, as well as targeted humanitarian support and mass care. For instance, we distributed 28,000 metric tons of grains, and we also rapidly expanded the National Social Register. But when people ask, did you get a palliative? I always say, well, the palliative was never really meant for the majority of citizens. What was available would have covered only a small percentage of our population anyway. Next slide. So these were one of the things that we are very proud of, are the issues of transparency and accountability. We had press briefings initially every day explaining what we were doing. It's now down to once a week, but we continue to bring forth all the decisions that are taken at PTF meetings. We also have a transparency dashboard, which is available to all. You can just go online, check it. It will tell you how much we have in our budget, how much we have committed, how much we have spent, how much PPE we have received from COVID, ventilators, etc., and where they were sent. And it's updated regularly. We have, to a certain extent, flattened the curve. Yes, maybe the extent of the curve would have been different. It may be much bigger if we had tested a lot more. But certainly, what we now have is a grumbling COVID-19 infection in the country. Next slide. So were there challenges? Yes, definitely there were challenges. As I said, we started off with a very low baseline as far as our health services were concerned. There was a very low sample collection and testing. Despite great efforts towards optimizing labs, we continue to have a challenge with that. There was a lot of collateral impact of the lockdown in terms of the economic and social impacts. And it was quite clear prolonged enforcement was not something that was possible. Ownership of the states continued to be a problem. There are some state governments that just don't think this is an issue. And sadly, we are still having to negotiate with them, etc. Every state government, the largest bulk of money we gave for COVID actually went to the states. We gave the states 50 billion naira. And I'm sure most of you will agree, 50 billion naira is not a small amount of money. In fact, the money that went to PTF itself, core PTF, was 22 billion. We gave 50 billion to the states. Lagos had 10, Kano had 5, and each of the other states had $1 billion each. And this money, as I keep on saying, is not meant for reimbursement of what they have spent. Rather, it is meant to strengthen the response in those states in particularly three things. Sample collection centers, making sure they improve their sample collection, improve their surveillance, and also improve their risk communication. 3 things. Very straightforward, very easy. I give you $1 billion naira, you have to account for it. So we continue to work with the state governments and insist that that money be used for the purpose it was provided for. We did not give the money for you to go and construct hospitals or improve the roads in your village. No, it's meant for COVID-19 and it has to be used for COVID-19. There's a lot more money that will be coming. There's a World Bank credit facility of just over 100 million US dollars that's being currently negotiated, and that will go to the states as well. So are there lessons learned? Well, there's a lot of debate. Closure of borders. Yes, maybe we should have done it earlier. Who knows? The second thing, the issue of proactive engagement of partners in terms of filling the gaps, particularly in risk communication and coordination. Number 3, the issue of schools. To be honest, if it was now, we would have put more money in education, because we only realized it when we started relaxing the restrictions, that a lot of schools in the country do not even have running water. So how can you ask them to open up without running water? So we would have put a lot more resources in those areas. But then, as I keep on saying, it's very clear we have a very low baseline across the country. Nigeria is a large country. There's a lot of variation. Some of the private schools, for instance, could have opened much earlier because they were actually very prepared. But the public schools, a lot of the public schools were not prepared. And therefore, we just had to delay their opening. We continue to work with the state governments and insist that they do a risk assessment. If they do a risk assessment, they should do a risk assessment on each individual school to make sure that they are ready. And if they are not ready, you've got to take that hard decision of not opening until they are ready. Because otherwise, the students will be bringing in the infections and taking it to their vulnerable parents or their elderly grandparents and end up having even more issues later on. Now, I'm pleased that the price of PPE has also crashed. Some of us will remember when these masks were being Realnews have lost money as a result. I'm very pleased that the price of these commodities has crashed. The other issue was the attention on economic recovery. Yes, we were harsh at the beginning, but there was a good reason. But Nigeria is not the only country that's been affected by COVID. Look at the UK. They've lost 17 years of growth. Their economy is down back to 2003 levels. The US lost 25-30% of their GDP. So we are not alone. Yes, it's going to be a very difficult 2021 for the country. But so really, we have no, yes, we don't have any regrets. We are sorry that the impact was very hard on a lot of families, etc. But at the end of the day, the responsibility of any government is really to make sure they protect the life, the health and the livelihood of their people. And then the issue of suboptimal 7. In Lagos, it's 50,000 naira per test. In Abuja, it's 38,000. Kano is 36,000. No, Abuja is 39,500 per test. Kano is 36,000. Imo is 38. The reason why it's so variable is because the negotiation is done by the state governments. No money comes to the PTF or the federal government or NCDC at all for the testing. But a small fraction of the money goes to the state governments for the purpose of their surveillance, etc., for the point of entry. The bulk goes to the laboratories, private laboratories. But I cannot understand a situation where you come into Lagos, you pay 50,000 naira for a test, and then you don't show up. 60% of our passengers currently do not show up at day 7. 60%, and these are people who have paid 50,000 naira to do a test. So what can we do? We can't drag you to go and have the test, but we know that you are a risk because the more people coming in with imported infections, the more difficult it will be for us to control COVID in the country. If we are bringing in between 110 to 150 new cases every day into the country, then COVID will never stop. So that's why we have to take the hard decision of suspending passports electronically for those that fail to turn up. And we'll be announcing those passport numbers in the coming days. We just want to be absolutely sure people have not tested at day 7 in another lab before canceling their passports. But they will be suspended for 6 months. And for some of them, they are frequent travelers. It's a huge inconvenience. But at least that will force people to do the right thing. We've got to know your COVID status at day 7. Because if we do that, we'll be able to rapidly go in, isolate you, or take the necessary precautions to make sure that you do not transmit the infection. But if you do not present at day 7, it's going to be a problem. because the number of passengers is too huge for us to monitor each and every passenger out of the 7,000 that are coming in. So what are the next steps? So we intend to intensify risk communication. I think this is the Achilles heel of the entire response, the fact that people are not accepting what we are saying. And as COVID comes down, a lot of people will start feeling that, well, it's not a problem. But in actual fact, if you are in the vulnerable group, it doesn't matter if there's only one case of COVID in Lagos and it happens to be you. You're on your own, really. So that risk needs to be a personal risk. That risk perception needs to be there. We will continue to have increased advocacy and support to the states, particularly working with some of the state governments that are challenging, without mentioning names, and hope that they do the right thing. And we are doing targeted intervention in high-risk local governments. 20 local government areas in the country are responsible for more than 50% of the infections we have. So we're putting a lot more resources into those local governments to make sure. And finally, we are reopening the economy. This is not going to be easy. This is the new normal. There will be distractions, there will be inconveniences, but I plead with all of us to please remember no epidemic lasted forever. This epidemic will go, just like any other epidemic we've had, just like the flu pandemic in the earlier years, etc. It will go. But it will go with a lot of people, and you don't want to be part of those. You don't. So finally, in conclusion, I think it's been a very difficult journey for the PTF and its members. We've had a very challenging assignment. I believe we've done our best hand on heart. We've delivered on our mandate, but the success of our mandate does not depend on just the PTF. It actually depends on all of us. This is all about personal responsibility. If we cannot enforce people staying at home, we cannot enforce people wearing masks, we cannot have police everywhere insisting that you behave in a particular way. Behavioral change is the only thing that would help us get rid of this epidemic. Back in April, May, when we started enforcing the wearing of face masks and other non-pharmaceutical interventions, if theoretically all of us had followed the rules, 5-6 weeks, this would have been over. By August, Nigeria would have been back to normal. This is what happened in some countries, for instance, in Southeast Asia. That was what they did. And they are more or less back to normal. But here we are in December, still struggling with a low-grade infection. Yes, it's not as high as Europe, but remember what happened to India. We should remember what happened to India. We know that the majority of Nigerians are very unlikely to have been exposed to COVID. Only a small fraction of us have had exposure to COVID. We know that from some of the seroprevalence studies, antibody studies that we are currently doing. And therefore, we have to continue to be cautious and to protect ourselves and protect our loved ones. Thank you.
I don't think this is good enough for such a brilliant. We need a standing ovation, please. Is this because of COVID? COVID. Can we brighten up here? I would now have to call Maureen.
May I have your attention? Thank you, Dr. Sani Aliyu, for this very thought-provoking presentation. And while you were talking, my colleagues were busy tweeting away, and they were saying that you came loaded with information. And we are very grateful at the lecture you have delivered, justice to it. May I let my colleagues here, all the journalists here, and those who want to get a copy of the lecture, that you should hook up to hashtag 2020 Real News Lecture to get a slide of his presentation. It's already online. So you can go to our website and then download it almost immediately. And all the other papers and all the other things that are going on here, we will have it and the pictures online. Thank you very much, sir. Finally, let us be conscious of what he said. COVID will go away, but we should not go away with COVID. This is very, very important.
Okay.
Ladies and gentlemen, thank you so much for your patience.
Once again, I'm introducing Comfort Coleman. He's one of us from inception. She just rushed in after being trapped in traffic. So from now, we're going to have a more vibrant discussion, and that's where we are. All right, Comfort Coleman, please.
Thank you very much, Sir Elvin. Yes, we're going to the discussion belt of this Realnews program, and it's to be anchored by Malam Mele Kiari, Group Managing Director. Okay, he's kicking it off. He's the Managing Director, Nigerian National Petroleum Corporation. Is ably represented here. Can we give a round of applause to Managing Director, National Engineering and Technical Company Limited, a subsidiary of NNPC, in the person of Usman Baba. A round of applause for him, please. Thank you, sir. I think we'll do better than that. Another round of applause. They need a microphone. Okay, as part of the discussion, we'll have Dr. Alero Roberts. She's of the Department of Community Health and Primary Care, College of Medicine, University of Lagos, Idi Araba. And Luth, thank you. Part of the discussions. We also have, I believe, Dr. Michael Ihe Maguba. Ihe Maguba, OBGYN, stroke family practice, state care, urgent care, New York, USA. He'll be joining the discussion virtually. A round of applause for the discussants, please. So will Malam Usman Baba like to kick off?
Good afternoon, ladies and gentlemen. My name is Usman Baba. I'm here to represent my GMD, Malam Mele Kiari. He has a small message for the Realnews magazine. So he appreciated this invitation. Let me just read the first paragraph before we go into the discussion. So he said, I'm immensely delighted to be with you here at this auspicious occasion, the 8th anniversary lecture of Realnews magazine. I'm even more honored to have the opportunity to share NMPC's perspective on the theme managing COVID-19 global pandemic in Africa, the Nigerian experience. Before I take a deep dive into the topic, let me begin by extolling the virtues of the Nigerian media for what it has stood for over the years. Engendering the responsible journalism, telling the truth to power, and above all, championing the cause of the common man for the sake of public good. I'm happy to know that these reasons were part of the reason why Realnews magazine asks us to converge here. So, for us to start discussion on this issue, COVID-19 Nigerian experience, the management of NMPC, when this started, they look at the situation and they call the medical team of NMPC to review the medical facilities in the country and came up with a recommendation. So they came up with 3 areas to assist the government. First is medical consumables. The second one is logistics, that's transportation, and the other one is the infrastructure. So these are the 3 areas. So the management mobilized the oil and gas industry, both upstream and downstream, to support the government because they know that this is above the government. Government cannot handle it alone. So they need support. So with this mobilization, they were able to generate up to $30 million, equivalent to 11 billion naira. But as the doctor said, all these donations were in kind. The management, in their own wisdom, decided not to collect cash. So they asked them to supply each company that pledge, they would ask them to supply particular equipment or medical supply. So that's how the donation went. And with this, NMPC was able to contribute a lot, contributed for in the National Disease Control Center here in Yaba and Gwagwalada. In short, that of Gwagwalada was just a building without any equipment. So NNPC completed that building and furnished it with modern facilities. Then with this contribution, so NNPC also proposed 200-bed post-hospital, each of with 200 beds across the country. So we have already done the groundbreaking ceremony in 3, one in Katsina, Imo, and Bayelsa states. Others will soon follow. So I think in terms of control in this country, we have done very well. We have done very, very well compared to other countries. The situation is not bad. As today, if you look at what we have, it's just about 65,000 cases total, and 61,000 has been discharged. So we have, yes, we have death, about 1,100. So yes, it's not good to lose life, but at least it's not that bad. If you look at the case, if you look at the US last week, it started from 120. On Saturday, it was 180-something thousand per day. So honestly, the case in Africa is well managed. The committee has done their best, the Presidential Task Force, they have done very well. So honestly, if we can sustain it, I think we can control it. The only thing I want to ask Doctor, because the last time when our cases ramp up, when we were about to close our airport, a lot of people came in. And that's why the situation got worse. I don't know what they are going to do now because Christmas is coming. And the situation is getting worse and worse in Europe and America. So what are they doing? Are they going to shut down the airports, or they are going to wait until the situation gets bad? If they need to take action, it's now that they need to take action. Because we don't want the situation to get bad. Thank you.
Thank you very much. A round of applause for him, please. Another round of applause. We'd like to call on Dr. Alera Roberts to make some contributions. A round of applause for her, please.
There's always a articulate delivery. I must state for the record that I work for government. And while I enjoy being at the front line of the battle against sickness, and I enjoy being at the front line of the battle for implementing tested strategies to promote health and well-being, and I enjoy being a shaper of the minds of the future. Like many of my healthcare professional colleagues, are being battered into a state of OTSD, ongoing traumatic stress disorder, fueled by the sometimes the world, I might add, to the current health crisis. No, not just COVID, but the triplet COVIDemic of poverty, ignorance, and greed. The truth is our collective well-being, our collective health, our collective rights to life, free of illness, disease, and disabilities, are all too often easily sacrificed on the altars of self-serving agendas. So I am part of the problem. And I also want to be part of the solution. So we can sit here and pat our backs. Indeed, a most articulate delivery based on science, loaded with verifiable data. And I do love the fact, Dr. Aliyu, that you very quickly recognized something that we would have done differently. And that's what I'm bringing to the discussion. Community engagement. Bringing the voices from the grassroots to the collective dialogue table, nationally and globally. I've been at the forefront Everybody knows my CV, maternal health, child health, breastfeeding, intellectual disability, any of those platforms, I'm there, personally touched. And so having to work with the foundation who puts floods of midwives out, and in the FCT, sir, you spoke most eloquently about the lack of road networks. They've had to go out through thick and thin, over hill and dale, through unmotorable roads to reach that last pregnant woman who is about to deliver and assist in making sure she and her newborn don't go the way of the COVID. Not because they have COVID, but because they lack everything else. I'm very impressed, thank you, Dr. Aliu, for mentioning that the biggest problem you faced was making sure health facilities and schools had something as basic as water and sanitation hygiene. And I hope and pray that we will leverage on some of this information that has come up. And we will take advantage of the new networks and partnerships that have been created to address some of these things. The COVID numbers in Nigeria reportedly are low compared to other countries in the world, other high-income countries in the world, and the reasons are yet to be scientifically elucidated. One wants to hope that, bearing in mind that 50% of our population is aged 18 and under, and this particular virus seems to have a predilection for the older people, that might be a reason. But that does not stop the fact that the next one coming, and believe you me, a next one is coming, the next one coming just might have a predilection for the younger and not the older. So I'm not going to speak to that. The amen. Many have called it fake news, accused the authorities of underreporting, insufficient testing, spouting several wild and unbased conspiracy theories. I'm not here to speak to that. I'm just here to be extremely grateful to God for his mercy. But I am here to take this opportunity to okay, on behalf of all my colleagues who worked and are still working at the front line. There are many, many questions. What are the plans for managing the biting, unintended economic consequences that have rolled over into everything else? The impact on our already abysmal health indices. What are the plans to leverage on these new exciting private sector partnerships to ramp up the training, recruitment, and retention of human resources for health? Mr. CMD, sir, I don't intend to spill the secrets of the house, but I know what we're facing, even in a health facility like the Lagos University Teaching Hospital. Easily the best equipped, best run health facility Nigeria has to date. Easily, without a shadow of a doubt. But we have a problem with the human resources for health. We have a problem with retaining our nursing staff. Everybody is aware of the doctor's brain drain. How many of us are really aware that there's a worse brain drain among the nurses, the midwives, neonatal nurses, pediatric nurses, theater nurses, accident and emergency nurses? We don't have enough. No, not even in the Lagos University Teaching Hospital. How can we, Dr. Aliu, leverage on the gains that PTF has made, the lessons learned, to address some of these things? You gave 1 billion naira to the states, and I remember commenting on television on a couple of occasions that yes, you gave 1 billion naira to the states to test 1% of their population. You had specific preconditions. This is not for this is not for that. Go out and do the testing. How, in all good conscience, can any governor, assuming he's not the governor of Lagos, so assuming he's not particularly committed to his people, let's just assume, leave all the pressing needs of his state, collect ₦1 billion and put it just in COVID testing. When the artisan would ask you, sir, if I test positive, sir, shame I draw daily, will I wait at home? Who will feed my children? If I don't push this cart, I don't even get 20 naira to eat. How was that going to happen? He had unpaid salary bills, and you gave him ₦1 billion for COVID testing without the support. Because as a public health physician, I'll be the first to say, don't test if you can't treat. Don't test if you can't treat. What are you offering them? Indeed, the collective Nigerian spirit is one critical element that has been responsible for both Ebola and COVID-19 being defeated. It's a spirit that is not going to go away anytime soon, as we have seen in recent events. And sometimes when you try and squash it quiet a bit too much, it erupts in areas we have not yet seen. But I'm grateful for that Nigerian spirit, because it is that Nigerian spirit that has brought us here and given us the Realnews platform to speak to each other. I do still work for government. They will not sack me. They will not keep me quiet. They will address these concerns. Thank you very much, sir.
Thank you so much, Dr. Alero Robert. That was very, very passionate. Another round of applause for her, please. Okay, we're going to have a virtual connection now from what is called the God's own country, United States of America, by Dr. Michael Ihema Aguba. A round of applause for him, please.
It's Zoom, right? Keep trying to connect with that. So we're bringing in the American guy.
Is Dr. Ihema Aguba there?
To speak to each other. I do still work but they will not keep me quiet. They will address these concerns. Thank you very much, sir. Thank you so much, Dr. Alera Robert. That was very, very passionate. Another round of applause for her, please.
We're repeating.
Okay, we're going to have a virtual connection now from what is called the God's own country, United States of America, by Dr. Michael Ihema Aguba. A round of applause for him, please.
Yes, I hope everybody can hear me. Can you hear me there?
Yeah.
Yes.
Hello? Hello? Can you hear me?
Yes. Mute. Mute.
Can you hear me there?
We can hear you loud and clear, Dr. Ihema Aguba. Yes, we can hear you. Please unmute yourself. We can can hear you loud and clear. Yes, we can hear you. Hello? Hello? would like you to repeat some of the things you had said because they were lost across the Atlantic. We had some technical issues here, so we did not hear all of what you said, so we're not in a position to ask any question. So please, if you can repeat some of the things you've said earlier. Just summarize some of the things you've said. Can you summarize some of the things you've said? Please summarize. Oh, okay. Thank you so much, Dr. Ihema Aguba. A round of applause for him, please, everybody. And we most sincerely apologize for the technical issues. We're in a new normal now, and we're trying to navigate this new normal. Gradually, we'll get a hang of it, and everything will work well. We would like to call on the chairman, Professor Chris Bode, to say a few words, and then, yeah, 1 or 2 words on the discussion.
Will be directed to Chris Bode and Dr. Aliu. Dr. Aliu, there's no doubt that some of us, we have been watching you keenly and watching this presidential task force as well. But to my concern, just like Dr. Alero said, the local government is part of the system in this country. And I don't think any one of you here sitting down today can identify any local government that you see, either the local government chairman or chairlady, coming to arrange or organize this so-called community engagement that was supposed to be part of the whole program. In my own local government, I can tell you there's virtually nothing. And if money is being allocated to stage and the impact is not felt at the local government, especially when people don't have the television to watch you on every evening broadcast, and even when they have the television when there's no electricity, we all know the problem. One would have expected having the Ministry of Information, Agency of National Orientation Agency there, to go a little bit deeper into the communities. These are some of the things we need. You see, it's a good thing that you guys are sitting there in Abuja and doing all this fantastic work, scientifically and otherwise. Fantastic, we all appreciate. We've seen how excellent your presentation was. But I want to say something. Let's get the local government guys involved as well. Let's get these people involved and let them speak the language of the people. You cannot speak English to the people of my community because my grandmother and so many people do not go to school. And I did not go to school myself. Emma Binu. You know, and then another thing is this 50,000 naira. You are saying is this for the travelers alone or for every individual? So that we know how to go about that. And Professor Chris Bode, I can share your problems. I've been to Lutz. I will not say my experience. Some few years, not too long. Precisely, I will tell you I was at the dental clinic. You can imagine some years or 4 years, it was a mess. But I won't say further than that. I can meet one and talk about that. I understand why it is there now. That's why I don't want to express that. I understand why it is like that now. But the fun about what Dr. Lee raises is sometimes if universities or teaching hospitals or higher institutions don't have enough, have to look out for people within and outside this country to assist. And that is why most of the things you have in that department now, they are from maybe the alumni and some people here and there. I can tell you there was a time, I don't want to make noise about myself, but I've trained more than 30 or 60 medical doctors in this country, in Germany, without telling them to pay money. When we write to institutions, maybe you were not there then, it is difficult for institutions to even reply. So it was bad. Yes, it was bad. But how do we justify keeping this for a long time? How do we justify that? You see, will we always need palliative in this country with or without COVID? Because of poverty level. So whatever we call palliative today will be a palliative tomorrow as well. Let's look at it critically. Thank you so much.
Another round of applause for him, please. Okay, so are we taking the comments or the answers right away?
Thank you. So the first question has to do with the need to engage the local governments. In actual fact, we've been working very closely, even at the grassroots level. As I said, we realized this a little bit much later after our initial clinical approach to the pandemic. Since then, we have regular meetings with commissioners of information throughout the states. We also have motorized campaigns that involve virtually every local government in the country. We also have engagement, and no, this is fine. We also have engagement right down to the grassroots level. So, for instance, in the north, we've made use of support networks linked to polio, for instance. The NOI have been doing polls regularly across the local governments. The National Orientation Agency has, I think, between 2 to 3 staff in every local government in the country. And we've been able to make use of them to provide additional information. More importantly, we've met with the traditional rulers in every state. We've asked every state government to have meetings with their traditional rulers and their religious leaders and their community leaders. And these meetings have been taking place across the country. When I spoke about the 1 billion, that 1 billion was not meant just for testing. We agreed on an incident action plan for every state where they outlined the 5 pillars that they would be working on: testing, surveillance, risk communication, case management, and issues to do with improving contact tracing across the board. These incident action plans were meant to be funded through the 1 billion naira. We we had an approach very similar to what you would have if you are putting in, let's say, a donor a grant application for the states. And that's why we keep on saying to the states, after we've agreed and we've given them the money, you cannot change your incident action plan. You cannot come back to us and say, well, actually, we've been spending money on this, so can we use it instead to paint our hospital buildings? It's a no. And we've made that very clear to the state governments, and we'll continue to insist on accountability. I know some of the states have not even moved the money from their FAC accounts to the dedicated COVID-19 accounts that we have recommended that they do. And there will be monitoring that will be done along those lines. The second issue you raised has to do with testing. So we charge testing only for travelers in the private sector. Testing otherwise is free. The NCDC receives a lot of test kits through our donor community and also buys test kits themselves. And these are then distributed across the states. In fact, for some of the states that do not have their own molecular laboratories and have private labs, what we've done is we've supplied the private labs with the commodities, and the state government then subsidize and pay for the test to be done. But nobody should be charged for a COVID-19 test unless they are travelers, because travel is a personal pursuit. Any other situation, it's free. And even with charging for travelers, it's simply because we are unable, we cannot afford to do it because of the scale of passengers that we have coming into the country. It's unlike, with all due respect to Ghana, the number of passengers coming through Ghana is small compared to what we have coming through Murtala Mohammed in Lagos, for instance. So even Ghana, I know they are charging, they are using a rapid test kit, but they're still charging for it. Certainly we cannot afford, and I cannot see a situation where we can afford free testing for passengers. But what we are working towards is seeing if a rapid test kit could be used in the very near future. This will crash the cost to possibly maybe 7,000-8,000 naira per test. So, and that would be a lot more affordable. But at the moment, it doesn't even look like it's the affordability aspect. It's simply the fact that people are not willing to do the right thing. You pay 50,000 naira and 60% of you do not even bother to turn up. We call you, we text you, but you still do not show up. It's like, okay, let me give them 50,000 naira, go away. Well, we're not interested in the money. What we're interested in is your COVID status. Even if you pay 100,000 naira, we'll still chase you for the test result. And if you don't do it, we will definitely suspend your passport. The issue of the palliatives is a difficult one. I completely agree with you. It's a very unfortunate set of circumstances. The private sector, when they came up with a really good idea, they did check with us and we told them, yes, any support that will be provided by the private sector is a good one. They spent 27 billion, COVID, 27 billion naira on palliatives, on food palliatives. 3 states had 1.4 billion naira each, minimum. Because of the amount of money, of food that they had to buy, there was concern about inflation, so they had to do it in stages. If they had bought all the food all at once, it would have led to food inflation throughout the country. So for some of the state governments, in fact, 28 state governments, they handed over the food palliatives to the state government and said, you can go ahead and distribute. For the others, there were aspects like rice that was not available, they hadn't provided rice, etc. But even in those situations, I know state governments like Borno, like Nasarawa, for instance, who went ahead and distributed their food items, even though it was not complete because Kakowitz said to them, you can still go ahead, take that decision and distribute to people. But at the same time, people were not patient because eventually those foodstuff would have been distributed to the needy ones. Nobody expected people to go and raid Kakowitz stores in order to get food. It's just like my neighbor buying food for my neighborhood and saying, okay, I haven't finished collecting all the bags of rice before I distribute to the neighborhood. The neighbors have no right to say, actually, we're tired, we're going to go and raid your house and take the food anyway. Yeah, that food, those palliatives were yet to be handed over to the public. They had been handed over to the state governments, and we should have waited for them to be distributed properly. And I hope in future we've learned our lesson, and hopefully it will not happen again. I will keep quiet from now. Thank you.
I wish to thank the gentleman, the handsome gentleman in the white agbada. I wish I knew your name, but the masks don't allow us to recognize each other. Please pardon me. I'm going to speak with you. The masquerade knows one. Nobody knows the masquerade. Perhaps we'll meet thereafter. I thank you for those words, frank words. Let me answer equally frankly. Without seeming to defend government, the government really tried in engaging people at the grassroots. As mentioned when I was being introduced, I come from a place called Ejigbo in Osun State. Ejigbo became a focal point when people from Cote d'Ivoire all stopped there. Those who were coming by road were all taken to that place because that is where most Nigerians living in Abidjan usually take off and they come from. A lot of my people stayed in Cote d'Ivoire. When about 17 COVID cases, positive cases were identified there, the state government engaged everybody. Opinion leaders, church pastors, imams, the Oba, the chiefs, even those of us in the diaspora. I had to make a broadcast in the local dialect for the people to understand that government was fighting on our behalf. And it was effective. The outbreak that was brought in from those who came there was effectively controlled. And that place has been made one of the COVID isolation centers in Osun State, where I come from. So it is actually something I can verify. Government has really involved the community. And it was very effective. Everybody obeyed. And there was no spread of COVID in that place. But speaking to the engagement of those of you in the diaspora with us here, let me tell you the times have changed. Before we leave the scene, it's our opinion that we must not do anything that will make future generations to cast aspersions on us. The hospital you said you visited 3 years ago is no more wearing. I can tell you they have over 30 brand new dental chairs provided by alumni, diasporans, some of us here too, corporate bodies, the university. So, and in Luth now, will you believe we are the only institution with our own generated independent power plant. We have 24/7 electricity and so many other things. We have the best cancer center in sub-Saharan Africa as of today. The best cancer center in sub-Saharan Africa. You don't need to know anybody. Just come there, just register, you get on. We have three brand new, the latest brand new 3 linear accelerators, brachytherapy and all that. Our X-ray center, the same thing. So, and I could go on, but today is not a day to start boasting about what we can do. And there are so many other things that we are doing to make you proud. Please approach us. And that's not only for Luth. You go to ABUTH, you go to Maiduguri, you go to Ife, go anywhere. There's a renaissance of what our capabilities can do. And therefore, if you have any good idea that you want to bring home, bring it on. Bring it on. We will match you with enthusiasm and transparency. Thank you very much, sir. I think for the purpose of brevity, we have to end the question and answer session and go to the next stage, the investiture. Thank you.
Thank you so much. Can I have the microphone? Thank you. A round of applause for them, please. Another round of applause. Thank you. Thank you.
We usually do presentation, and it's been our standard practice to have a chairman present listen to the guest lecturer, and then we take it from there. It's a ceremony that Realnews takes so dearly. They love it. And then camera. We now have a very important program running. So please all focus here. I'm going to call upon the guest lecturer. Doc? Yes, please.
To a courageous leader, team leader of the Presidential Task Force, and for the recognition of the invaluable role played by Mr. Boss Mustafa as guest lecturer, which you have eloquently done today. I present this. The recognition of the invaluable role played by Mr. Boss Mustafa as guest lecturer, which you have eloquently done today. I present this.
The surprises of life is that you can have a man who is simply Mr. making a presentation to a professor. But on behalf of Realnews, I want to present this plaque to you for chairing this occasion this afternoon and doing it so very well. Thank you very much.
Thank you. A round of applause, please. Next.
The recognition of the invaluable role played by Mr. Boss Mustafa as guest lecturer, which you have eloquently done today. I present this. Yes.
Can we have Mr. Femi, please, to come and make a presentation on behalf of Realnews?
But on behalf of Realnews, I want to present this plaque to you for chairing this occasion this afternoon and doing it so very well. Thank you very much. On behalf of
a round of applause, please.
On behalf of Realnews magazine online, I'm proud to present this for the induction of Realnews Hall of Fame presented to Malam Kili Kiari, Group Managing Director, Nigeria National Petroleum Corporation, by the management of Realnews Magazine and Publication Limited. Thank you so much for coming. We appreciate it.
Okay. Nza. Can we have a Brigadier General Nza, please, to come and make a presentation to Dr. Alero Roberts?
quite a pleasure presenting to you on this occasion of Real News as a member of the Hall of Fame, presented to Dr. Alero Roberts. Congratulations.
Very much. And shall we salute?
You want to respond?
Very sharp one.
Okay, all right. Another one. You come on the packaging. Quick, 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 quick. Okay. Okay. Oh yeah, one more, we're done.
One more, please. One more.
Calling upon the Ghana Consul General, James Yasembi. James Yasembi.
A round of applause for him, please.
Okay.
Is accepting on behalf of Dr. Ihema Aguba.
On the guy in diaspora, one of our guest discussants. So, well, you accept on his behalf. Okay.
Who is presenting to Landra? Who is accepting on behalf of?
Okay, okay. Please, Larry, come here. Where's Larry?
So who is presenting? You are accepting on behalf of? The person who joined us online.
Yes, my brother, today is a very big occasion, and Real News is happy to present to Dr. Michael Yemaguba. The citation reads, in recognition of the excellent role you played as a discussant at the Real News 8th anniversary lecture under the theme, Managing COVID-19 Global Pandemic in Africa, the Nigerian Experience. So,
thank you so much. Thank you.
So we now have
group pictures.
Group picture of the new inductees.
Yes. Can we just do it, please? To complete where's the guys? Okay. The chairman?
Is it the chairman?
Yeah. One more program. On behalf of you.
On behalf of.
Let the boss do it.
Okay. Okay, sir. Acceptance speech on behalf of.
Okay. I'll just come to the podium. Yeah. So on behalf of all those that have received the investiture and on behalf of Okay.
Sorry, sir. Please, can we settle down, please? He's making an acceptance speech. Thank you.
Thank you. So on behalf of all those that have received the investiture and on behalf of the Secretary to the Government of the Federation and Chairman of the PTF, I would like to humbly accept the investiture. I would also like to really thank Realnews and in particular the organizing committee and Maureen and her team for the good work they've done today. There's no doubt COVID-19 will remain a very important topic going into 2021. As I said earlier, this pandemic is not over yet. I think not only Realnews, but also the entire national Nigerian media have been very supportive of the government's response and have also been very responsible in providing the right information to the public. We hope this really effective and strategic partnership will continue, both with the government and the private sector. And on behalf of all of us sitting here, I would like to thank you most warmly and wish you all a safe journey home. Thank you.
Yes, let me, both of them. And then prayer, national anthem, everybody, lunch. Yes, I'm not wasting time. Okay. Thank you, ladies and gentlemen. It's been a wonderful day, and we are gradually wrapping up proceedings for this day. And I'm standing here to thank everybody who is here, who has made time out to be here and has stayed these few hours here with us. I thank you so much. But then let me especially thank the chairman. He didn't give me any trouble when I got to him. He was so nice about it that I was wondering, is this Professor Chris Bode? Though I've been following him, I've been writing stories about him, but you really get to know somebody when you have asking him to do a favor to you. And he did so, he accepted so graciously. So we are really, really grateful. Thank you so much. Thank you. And you have perfectly chaired this and ended it the way it did in a very professional manner. We are really grateful. Thank you so much. When this inspiration to host this Managing COVID-19 Global Pandemic in Africa, the Nigeria Experience came, we were wondering in Realnews who would be the perfect person to deliver this lecture. And then we brainstormed and we found out that the perfect match is Boss Mustafa, because he's a policy wonk, because he's the person the president deemed to have the right capacity to chair the presidential task force on COVID. And we felt that he will have the overall idea of what exactly happened. We will have the intelligence report, he will hear the economic angle from everybody who is briefing him. So we narrowed down on him, and we approached him, and we wrote him, and he accepted way back in August, and wrote us back that he was going to deliver the lecture. And we have been updating him with information up to the last moment. Even while we were inside this hall, to tell you that he is following what is happening, because his mind is here, his spirit is here with us. Just as I was finishing my welcome address, I got a text message from him why he could not make it yesterday. Remember, I told you people at the beginning that by Wednesday evening, I was told that he had 99.9%, but I should pray for the 1%. But that 1% happened that the president needed his attention more. And he sent a text message to tell me that from 10 a.m. this morning, he's been with the president because the COS was not there. So he had to stand in for him. So you now know why he's not here. But he said he's here in spirit with us. And then that once he finishes with assignment with the president, he will get in touch. Hopefully, he was hoping he could at least say one or two things online to all of us here. but I'm not very sure he has finished with the president. So why I'm saying this is to know that, let you know that he is here, he is monitoring, he is watching online, and he is very happy that you all came here to listen to him. So I thank him. I will owe him a debt of thanks. Please, sir, convey our hearty and sincere thanks to Boss Mustafa. And he chose a very capable person. You know where they brought him back to come and head to be the national coordinator. And you can see the delivery, the masterful delivery, the professional delivery, the facts that he gave. And when he was talking, some of my colleagues there told me, look, that he's loaded with information. I should double up so that they can all run away with the news. Because there's so much to give out. There's so much information to give out. And that's one of the reasons why we decided to host it here in Lagos. Because they talk so much in Abuja, and everybody sees them, they say it's Abuja people. Then when they come back to meet a different kind of audience, like we are here, people from all walks of life, they will now be talking, and we will listen, and the message will sink in more. And I think you did justice to that. Thank you so much for doing us this great favor. We are grateful, Dr. Aliyu. Thank you. Dr. Lero, I just met her for the first time today. The only woman in the group, the only woman left standing. And you can see the passionate way she spoke. I admire her so much. Thank you, madam, for graciously accepting our invitation to come here. 2 doctors linked me up to him. And then I'm just meeting her. In fact, when I saw her, I said, oh, you. Thank you, madam. Thank you, doctor. I'm so happy to have met you at last. God bless you. Then, Melekere. I've covered the oil and gas industry for as long as I can remember. And we recently did an interview with him. And then he was one of the people who also graciously accepted. And as far back as August 16, also wrote us to tell us that he was going to be here for the event. But again, I cannot compete with President Muhammadu Buhari. And nobody here can compete with him. So once his attention is needed, he needed the attention of Melekere. Also, he has a presidential assignment. He had to go. And he also sent a very capable hand, the MD of NESCO, seated right here with us to discuss the paper that was presented. Sir, please convey our basket of thanks to him. Thank you, too, for coming. We are really very grateful. Dr. Iheme Aguma is a doctor of distinction. He's well known. In fact, in New York, one of the key things he did when he was in New York, and I was still in Newswatch at that particular point in time because it was a source of information for me in Newswatch. He did something very historic years back when they brought in a pregnant woman who was brought in dead. So the woman was already dead. He was an accident victim. But he was very pregnant and was due. So what he did was to operate on the woman and then saved the life of the baby. So he became he made headlines in news. And he has been involved in this COVID. Unfortunately, we didn't hear much of what he has to say because he had a personal experience with COVID. He treated so many COVID patients, and in the course of treating so many patients, as Dr. Aliyu said, became a victim. But he also survived. So if you had listened to him, some of people who are online must have heard what he said. If you are listening to him, you will now have reason to believe that COVID is real and that we must mask up and do the needful, obey all the health advisory, so that we don't, at the end of the day, when COVID goes, we will be counted among the number of people who went away because of COVID. So we need to do the needful. And we thank Dr. Michael Iheme Aguma. As at the time he joined us by 10 o'clock, it was already 4 a.m. in New York. So you can imagine that he must have been awake before that time to get prepared and set to join us. Unfortunately, the technological glitch we had there didn't allow us to hear him. But those who are watching the live streaming, I was told that they got much of what he said. So thank you, Dr. Ihema Agoba. We are really grateful for honoring our invitation and taking the pain to be with us at this point in time. Thank you very much. Now I have to thank everybody here. I have so many of my colleagues here. I have the Guild of Nigerian Guild of Editors, the president, Mr. Mustafa Issa. He was here very early, one of the early birds here. I thank you for coming. Thank you so much for your support. And the Ghanaian counselor, he was one of the first people who wrote me, called me to tell me that he will be here. And he came right on time. So we are really very grateful. Thank you. I still remember the tremendous support you gave me last year when I hosted your president here. Thank you so much. I hope the partnership will continue. And then that Ghana and Nigeria will resolve this, our problem with the traders. We will resolve it because we are friends. Thank you so much, sir. Now I have to thank my boss. I worked with Newswatch for 14.5 years, and he perfected me as a journalist. And he is Mr. Dan Abwese. And he came in here and he came in early. So Mr. Dan Abwese, please stand up for further recognition. Thank you so much. And my big brother, Mr. Femi Daguro, and my big auntie. I haven't seen her for a long time, so you can imagine. She came because of this lecture. Is the wife, Mr. and Mrs. Femi Daguro. Please, thank you so much. I am really, really very grateful that you came. Welcome. Thank you. Then I have so many people from I am from Umoji, in Idemili local government in Anambra State, and I have my people here, ably represented by baristas. They are seated here, and Pius or Kaneme. And my brother-in-law who flew in from Enugu, he is seated right there, Engineer Jenike. Thank you very much. I have Hope Opera who is here. Thank you. I have Engineer Dodo. I have members of Guild of Corporate Online Publishers. I hail you. Thank you so much, all of you who are there. Thank you. And I have Chief of Army Staff, Lieutenant General Tuko Brutai. He is one of the early birds. He's been here. They called to acknowledge that they will come, and they are here, and he stayed to the end. Thank you very much, sir. Please convey our basket of thanks to your boss. Thank you, Nza. We really appreciate Brigadier General Nza. Thank you. Thank you so much. Then we have the Managing Director of oh, thank you. We have Chief S. Sunday, Managing Director, GSM Tours and Travels. Thank you so much. We also have Dr. Reverend Kehinde David Akala, who said our opening prayer. He was my parish priest. Thank you so much. Thank you so much. Thank you for coming. And for that, starting us off in a godly way. Thank you so much. We recognize the representatives of UNIZIC alumni here. Thank you so much. And Hope Opera is the president of Eco Film Festival. Thank you. Sunday, Managing Director, thank you. And I have to thank all the people, the advertisers, the NCC, the NNPC, and there's Mike Oji from NNPC too. Thank you so much. I've thanked them. And then Chief Tony Onyelaya, Anthill Investment Limited. Thank you so much for coming. You were also one of the early birds. I have Mr. Becca Anjori and Engineer Mike, Engineer Dodo, Ayiba Dodo, who is there. I cannot mention everybody by name, but I thank you all for coming, and I thank Sheraton for hosting us well. Thank you, thank you, thank you. Please, we have lunch. We have lunch. but we should take it table by table so that we can get it. And I need to thank the representative of UNICEF who was here, Dr. Njoko. He was here early here, but he's gone. Lanre Lavi, please, thank you very much. Thank you so much. Yeah. Then we have to call on Alhaji Tajuddin Karim to please come and say the closing prayer. Alhaji Tajuddin Karim, please come and say the closing prayer. No, come and say it from here. Yes. Okay.
We thank Almighty Allah for this day, a day that is so blessed. We pray Almighty Allah to keep us till next year, when we're going together, God willing, for the 9th edition of this wonderful event. Alhamdulillah Rabbil Alameen, Rahman Rahim, Maliki Yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
So thank you all for coming. May God take us back to our various destinations. And then same time next year, we will be here in good health. And there won't be no COVID, so there won't be so much stress.
Amen.
Thank you. Okay, as we are doing lunch, please, we have a stand for blood pressure check. I also have to thank Global Generics. They have a brand new product there. Please check out that product. It's a wonderful product. It might be good, it will be good for you. So check it out, Global Generics. Thank you, your MD, Steve, and Chairman, Osita Idemili. Thank you so much for being part of our program. Yes. Thank you very much. Congrats. Thank you. Thank you. I was looking out for you, but I didn't see. When did you enter? The lecture has started. Next year, if you buy this from anywhere next year, so next thing. This is next, and I have to thank all the advertisers. I think I said it right. Yes. All the advertisers, I'm thanking them. Next thing, First Bank, Fidelity, all those who supported us, NNPC, NCC. Thank you all. Thank you all. Thank you all. No problem. I'm going to make it.